Hi everyone, and welcome to the Code Clarity podcast. I'm Rena, and I'm delighted today to be joined by Dr. Tim Ringrose from Cognitant. Welcome, Tim.
Hi, Rena.
Can you please tell our listeners a little bit around, yourself firstly, but also what Cognitant do?
Yeah, I'm originally a nephrologist, a kidney doctor from Oxford, and I've been involved in digital health for a number of years now. First of all, DoctorsNet UK, which was a big physician social professional network that was bought by M3 quite a long time ago. And then most recently, I founded a company called Cognitant Group, and our focus is providing patients and the public with personalized, trustworthy health information and self-management tools.
Brilliant. And this is obviously the reason why we've invited you along today, because you are going to be speaking at our conference in November on this very subject about digital patient empowerment. Now, the theme of the conference is compliance confidence for a competitive edge. So can you explain what your thoughts are around, what pharma should think about being more competitive in this realm of digital patient empowerment?
Yeah, well, I'm really looking forward to the 11th of November when the event's on. We work with both with the NHS and with pharma, so it's very interesting looking at the interplay between the healthcare system and the life science industry, and it still feels like they're quite separated. So the way I think about it, it's like there's a party with a fence in the middle, and there's one group on one side and the other group on the other side. And traditionally, clinicians have been quite wary and skeptical of the motives of industry, sometimes justified, but it's led to a very dysfunctional relationship. They're quite happy for the commercial party on the other side of the fence to throw money over, but they're not that keen on taking the fence down and really seeing, let's party together, let's work out how we can really fix some problems and improve healthcare together. And so I think the challenge is how do we do that?
That's a big old challenge. And I presume there isn't one clear solution. But I mean, we talk a lot about the negative ways not to do things because that's what cases and complaints are based on. So we're really hoping that you'll come along to conference with a couple of good news stories.
Yeah, well, I mean, your point about compliance is absolutely right. So going back to my analogy of the party with the fence, compliance is like reinforcement to the fence. It's
Okay.
making the fence harder to take down and giving people an excuse not to try to take it down, saying, oh no, we can't take that fence down because we need steel cutters, we need wire cutters, we need to get a tractor in to push it down. So I think compliance is often used as an excuse, isn't it? I think the theme of the conference is amazing. It's great. How do we enable everyone to achieve their goals, whether it's a commercial goal or improving health outcomes, or improve the efficiency of the NHS and the capacity of the NHS, by working together and not letting compliance get in the way. If compliance could become an enabler rather than an inhibitor, that would be the best outcome, wouldn't it?
Yeah, absolutely. And I love this analogy. And it's almost like imagining a world where there is no fence and there is this big joint party, and then thinking about putting that fence back in. And does that really change anything or not? I wonder. Okay, thanks so much, Tim. We're really looking forward to your session. It's going to be a 1-hour workshop. So just encouraging everyone out there who hasn't already bought tickets to please come along. In the meantime, thank you so much, Tim, for your time.
Thank you.